Thank you for inviting me. Thank you to the organizers, Mr. Deputy Prime Minister, Mr. Tobias, and others. Ladies and gentlemen, I'm going to talk for a minute about the world of technology, but if I start by asking you a question, what are the 5 biggest problems in the world that we face today? Some of them were on the earlier chart. Global climate change, energy self-sufficiency and energy sustainability, food security and food sustainability, clean water might be the 4th, and 5th would be healthcare. All 5 of those problems of the world today, the top 5 problems of the world, are answered by biotechnology. So I want to speak to you a little bit about biotechnology. I'm going to use the healthcare example as a place to start. Mr. Gage also indicated in his opening remarks that it's important to separate this audience into 2 piles, those with money and those with ideas. We have a lot of ideas, but we also have $2 billion, and we're one of the largest investors in the world in healthcare and biotech, biofuels innovation. So if you're looking for people that have money to make a difference, I go in that category. I think if you look at healthcare, you have to understand several things about the healthcare system. One is it's a marketplace in which the consumer, that is to say the user, has no idea what the price or the cost or the value of the technology is. That's a very unusual place to sit. Healthcare is a menu without prices. Secondly, if you look at our healthcare systems around the world, we ask ourselves, what is it that we want from our healthcare system? And what we want from our healthcare system is improved access at lower cost with better outcomes. And technology will enable us to do that. But I think it's also important to recognize that if you look at the healthcare system in the world today, the healthcare system in the world today, the healthcare system here in Russia, the healthcare system in the United States where I'm from, is virtually unchanged from a system of 1,000 years ago. That is, 1,000 years ago, we waited for disease to occur, and we went to some form of local healer, and we did something, most of it didn't work, and we died. Today, 1,000 years later, the healthcare system is the same. We wait for you to get sick, and when you get sick, you interact with the healthcare system. That is to say, you go to a doctor, or you go to a hospital, or you go to a nurse, or you go to a clinic, and they try and do something, and in fact, most things don't work. So we have a healthcare system today that is not a healthcare system. We have a dysfunctional sickness care system. And where technology is taking us, and the brief comments I'm going to make today, is that technology is taking us to an efficient, effective wellness care system that is predictive about what's going to happen to me, and we're going to be preemptive about disease. So rather than treat disease dysfunctionally, we're going to be ahead and manage your state of wellness, and technology will enable us to do that. I think it's also very important to recognize that the drivers of the healthcare challenge today are an aging population. This is a country of roughly 140 million people. If you look at a country like China with 1.2 billion people, China by 2020 has 500 million people. That's 5 Russias of people over 65 years of age. In the United States today, we spend about 80% of our healthcare dollar in the last year of life. It's not efficient and effective to spend massive amounts of money on an aging population, and because of that, healthcare will bankrupt the world if we just treat it the way we have today. Secondly, we can plug me into enough technology that death becomes optional. So 76% of our cost in the world today is for chronic care, maintaining people in a state of some kind of disease, but managing that disease so something else kills them before their disease does. Thirdly, if you look at a problem, most new technology by most people increases the cost of healthcare. That is to say, we can do something today that we couldn't do before, and that adds cost to the system. And then finally, I would just say that one of the giant challenges we have is a lack of connectability. We've talked here on the panel this morning about the importance of technology that will add to interoperability or interconnectability. If you are a patient in Moscow at a hospital or at a doctor or at a clinic, that information is not available to me in the United States, nor is it available to people elsewhere in the world. It's not privacy that keeps that from being available. It's that we have no connectability of that information, and therefore we can't use it to actually solve problems. So what I'm going to talk about quickly, whoa, can I go back to the third slide? This is the end of my speech, not the beginning. Can I go way back, please? Thank you. I'm going to talk about 5 elements of healthcare quickly. One is regenerative medicine. Secondly, the world of precision medicine. Thirdly, the world of molecular diagnostics. Fourth, the world of imaging, digital health, and big data. Sorry. In the world of regenerative medicine, most of you know that we now have stem cells. Stem cells enable us to change the nature of who we are and what we are, and to replace defective organs. We are living in a world of regenerative medicine. This is not science fiction. We have stem cells today. We have gene therapy and cell therapy that allow us to repair body functions, to replace tissues, to reverse aging, and to potentially cure, not just treat disease. Most of healthcare today is a treatment of symptomology. That is to say, we're treating the symptoms of disease, not the course of disease. Regenerative medicine will enable us to actually change the course of disease and to rebuild the body parts as they wear out. Secondly, we're living in a world of precision medicine. We have the ability today to do targeted therapies. The world of pharmaceuticals is a one-size-fits-all world today. We assume that we are all the same, and therefore a drug that we develop will work equally for all of us. But we are highly variable. We're variable by size and weight and gender and ethnicity. And so we are actually relatively the same, but individually different. And we have technologies today that will allow us to understand what is the specific disease that I have and what is the specific treatment that will do that. If you look at white blood cell disease, a definition 100 years ago, 50 years ago we realized that was leukemia and lymphoma. Today we recognize that that is 100 different diseases. And the question is, what is your specific disease and what is the treatment of that? And that avoids obviously an enormous amount of waste and other things. Secondly, we're living in a world of molecular diagnostics. If you think about value, historically value has been in pharmaceuticals that treat disease. Value is now going to be in diagnostics that identify what is it that I have and what particular drug is going to work for me. So you're going to see a conversion from the RX, the drug having value, to where they become more like the commodity chemicals and the diagnostic have value. We have extraordinary technology driven by high-speed, low-cost sequencing, where we can now, in the lab, not in the commercial world, but in the lab, we can sequence everybody's genome in this room for $100. I have had my genome sequenced. I'm one of the few people in the world that knows everything about me as a genetic being. And we can take that information and we can change the nature of diagnosis and therefore the nature of treatment, dramatically reducing costs and improving outcomes. We talked a little bit about imaging technology. We talked a little bit about it earlier in this panel in the context of nanotechnology. We have methods that will allow us to image what is going on in our body. We can put an integrated circuit in the front of a pill, and when you swallow a pill, we know what's going on. We have imaging technology that allows us to do things on a non-invasive basis. We have technology that allows us to interpret information and get low-cost solutions because we can image things on a remote basis. Whoops, I lost my slides. Could I have the slide on digital technology? But while they're pulling up that slide on digital technology, I'll make a very quick demonstration. This is my iPhone, just like every iPhone that you have in your pocket. But in my iPhone, I can push a button, and through my shirt, I can see my EKG live right through my shirt on my cell phone as I stand in front of you. This is using existing systems, that is to say, it's a standard iPhone, no different than any of yours. I happen to have some sensors on the back. Those sensors communicating through a unique system, not Bluetooth, communicating into the system and up to the cloud, allowed me to change the nature of place and change the nature of patient involvement. So historically, you would go to the hospital or doctor, you would get a 12-lead EKG to figure out how your heart's working. I can do it on a real-time basis on my cell phone at any time in any place in the world. So if we could go to my slide on digital technology, I'll see if I can. We have massive transformation around digital technology. This is not biotechnology in the context as John indicated, but it's a confluence of other technologies that are changing the nature of healthcare. So an array of technology moving into this world of this dysfunctional sickness care system. And the challenge that we face then is to understand value. Value is different than sales price. But let me make a simple example of value. Think about Google, think about Twitter, think about Facebook. Think about technologies people use all over the world every day. What is the revenue model for those companies? They give their technology away for free. You use Google, you use Facebook, you use Twitter. It doesn't cost you anything. Value is created outside of the product, not in the product. Most of the technologies that we're talking about here today, value is created in the product. So I want you to think about healthcare in the context of creating value, but value isn't necessarily measured by margin or in the product. The other thing to recognize about value is a function of different moments of time. It's a function of different moments of geography, and it's a function of different moments of who it is valuable for. Something may be valuable to me as an individual. It may be valuable to the Russian healthcare system. It may be valuable to the doctor who can provide information about what's going on. So we are in a world of healthcare in which we're using technology to create extraordinary value, but value is not a constant. And so the scientists in all of you would like to think that if we did enough math, we could compute the value of technology. But the value of that technology to the Russian healthcare system, the value of that technology to Aetna as a payer in the United States, the value of that technology to the Mayo Clinic, who is one of the largest integrated healthcare systems in the world, and the value of that technology to me as an individual are violently different. So healthcare is being transformed by technology. It is empowering patients. It's creating extraordinary value, and value is not a constant. So as we move from this dysfunctional sickness care system to an increasingly effective and efficient wellness care system, we're going to use technology to create incredible value. Thank you very much.